Hello, everybody. Tonight, I would like to speak about an article about computerized order entry system. This article is published in healthleadersmedia.com, and this article was written actually by Gianna Shaw, who is a senior technology editor at Health Leaders Media. And Gianna Shaw can be contacted at gshaw@healthleadersmedia.com. Gina described an article about some of the problems that we're fighting with the computerized order entry system. She says that despite the numerous benefits, the computerized order entry system can be dangerous and even deadly. That is serious business. It can be deadly because it can have medical errors if not properly implemented and tested. So there are some problems with the computerized order entry system, and Gina states that incomplete or inaccurate order sets, hurdles to adoption, and lack of testing can turn a system that's supposed to improve patient safety into one that can put patients into harm's way. And how does that happen? That happens because of some of the insight that we have gleaned from the study conducted by the Leapfrog Group, a large consortium based in Washington, D.C., that is interested in improving safety and quality and affordability in healthcare. So, the Leapfrog Group recently published a survey where they assayed 214 hospitals to test their systems to see if they would catch common medication errors, including potentially fatal errors. The CPOE systems, on average, missed at least 50% of routine medication orders. That is serious business. The CPOE systems, on average, missed 50% of the routine medication orders and about 30% of the potentially fatal orders. Now, those are very, very huge problems. And the Leapfrog also looked at a subset of 102 hospitals that had taken the test twice between the June 2008 and January 2010 and found that nearly every hospital improved in one or more medication categories. Now, Gina Shaw says that there should be a red flag for every hospital and IT company in the United States, But the Leapfrog Group suggests that we can do three things as healthcare leaders. One, we can work together. Several hospitals or health systems come together and work together to make it easy. We need to keep the CPOE simple and manageable, and we need to continue monitoring and testing the CPOE system. So, there are some good examples of some healthcare systems that have worked together. And one good example is suggested formation of Care Collaborative to create a library of more than 1,000 order sets. For example, St. Louis-based Ascension Health, the Winter Park in the Florida-based Adventist Health System, and the San Francisco-based Catholic Healthcare West develop sets in partnership with their clinicians. And these three institutions, again, the St. Louis-based Ascension Health in the Winter Park, and the Winter Park, Florida-based Adventist Healthcare System, and the San Francisco-based Catholic Healthcare West, are working together with Zinc Health, a decision support vendor based in Los Angeles. And since they are working together to develop a common data set, and that makes things much easier. And how do we keep the CPOE simple? That is easy. It's how we create the graphic user interface so that the graphic displays are easy to read and understand. That is very, very important because physicians can be bogged down by too many alerts that make it difficult for physicians to read and navigate. Now, too many alerts provoke too many extra clicks and not kind of confusing and tiring to cope with. Now, the third point is that we have to continually test and monitor the system. Monitoring is very important, and testing it is very important as well. How do we test? We can interrogate the system, we can incorporate rules, or we can bake in the decision rules so that the system is able to test itself and monitor itself and fix the flaws as they arise. And we can align these rules with the federal meaningful use requirements. We can also monitor the missed alert at least every month and then perform a detailed root cause analysis anytime there is a medication error. These are the 3 key points that came out of the study by the Leapfrog group as reported by Gina Shaw. And Gina Shaw is the senior technology editor for the Health Leaders Media, and she may be contacted at gshaw@healthleadersmedia.com. Again, gshaw@healthleadersmedia.com. Thank you very much.